Hey everybody, so I haven't done an update in a while. I thought I'd do one for those of you who are interested in the medical like fiasco that is my world. First of all, today is July 9th, 2025. July 13th will be the 2-year anniversary of the coma. If you don't know about the coma, well, you can go back and check some of those videos where I go into depth about that. I am a type 2 diabetic who is insulin dependent by choice because, quite frankly, terrified of oral meds after the one that almost took my life. I also have a very rare autoimmune disease that I was diagnosed with in October, but I've been dealing with it since August, so getting close to a year. It's called relapsing polychondritis. My body attacks its own cartilage. That's what's up with my voice. So I am on, at this point, I am maxed out on methotrexate. I am maxed out on CellCept. I just started a biologic injection called Humira. I inject it twice a month. So every 2 weeks I inject it. Takes 2 to 12 weeks to see how well it's going to work. I'm on week 3. I did my second injection last Wednesday. I also take folic acid. Of course, I use 24-hour insulin, and because all of these medications raise blood sugar, I'm also on corrective insulin throughout the day. And I am also on prednisone, which wreaks havoc on the body. I've been on it since October. Wreaks havoc on the body. And like it causes moon face, which is why my face looks so puffy and whatever. That goes with the prednisone. I started at 40 milligrams. We've been able to taper to 20. But the hope is, my rheumatologist's hope is that I will be able to get off of prednisone, taper off of CellCept, maybe even be able to taper off of some of the methotrexate. She agrees with me, she doesn't want me on any more meds than I absolutely have to be. And in fact, we talk about it at every appointment. I see her once a month. I do lab work monthly, although this last time she said we were going to push it to 2 months. So far, Mary Kate and Ashley, it's what my sister named my kidneys when they shut down during the coma. Mary Kate and Ashley and my liver so far are holding steady. So that's good because all of these meds can attack all of that. Today was vocal cord specialist guy. Last time I saw him was 3 months ago, and my voice was so much stronger then, but I had a really bad infection. Had to go off of methotrexate because I had to be on antibiotics for a month. You cannot be on methotrexate and antibiotics. So my voice kind of backslid at that point. He said that my ears look good because my body attacks its own cartilage, which attacks my ears, my nose, my trachea, my breastbone. It can cause aneurysms around the heart with the blood vessels. It can cause your trachea to collapse, like all kinds of scary things. But he said all my structures seem to be intact. It has obviously already caused deformity to my nose. But he said inside the structures look okay. He said my trachea looks great, ears look great. He ran the scope to look at my vocal cords. If you've never had that done, not really a lot of fun, but he did numb it very well. Basically, they numb, you inhale lidocaine numbing spray, and then they put a camera up your nose and then go down. And it's about as pleasant as you think. And then afterwards, he walks me through the video of it. So it's obvious like your vocal cords are kind of in a V, and he said my movement is wonderful. He had me, making sounds and whatever. He said the movement is beautiful. He said that that it actually looks good, except, they're still too close together. To me, it looked like they were maybe not as close together as they were the first time he ran the scope, which would indicate less inflammation. But he said, again, this is like inflammation he sees in smokers, and your girl has never been a smoker. But, he said he gets all the weird cases. So he's actually seen 3 or 4 cases of relapsing polychondritis, as has my rheumatologist. So God stepped in big time and put me with a rheumatologist and a vocal cord specialist who have experience with this horrible, very rare, 3 in a million people get it disease. So the game plan is he's going to wait until I've been on Humira, for a few months. I'll go back in about 3 months, end of September, beginning of October. He will see me in the clinic portion instead of in the regular exam room. He'll run the scope. If he said that it's not dangerous because my breathing is still good. He said if the inflammation or whatever is still there, if that little flap of skin is still there, at that point, he will do more lidocaine all the way to my vocal cords. He will go in with a laser and he will cut that off. He said it's a pretty minor procedure. In fact, he said I don't need anybody with me, but if I have anybody with me, they can actually just stay in the room while he's doing the procedure. So, yay, who wants to go watch that? But I asked him, we'll have to be on antibiotics because, again, my body does not heal because I'm on so many immunosuppressants for the relapsing polychondritis. And he said no, because I have to stop taking methotrexate if I'm on that, if I'm on antibiotics. And he said no. I asked about pain. He said he hasn't had anybody he's done this for even say that they needed over-the-counter pain meds. Asked about recovery time. He said can't eat or drink for about an hour and a half after. I'm guessing because there will be a lot of lidocaine. My vocal cords will be numbed. Can't really swallow well like that. And he said, just don't push your voice for a couple weeks after that, but then I should be able to start seeing significant improvements. The thing with a lot of vocal cord surgeries, and I don't know if this is one of them, but a lot of them, you kind of get one shot at it. And then if you get the issue again, it's not as easy to go in and take care of the issue, which might be why he wants to give the Humira a chance to work. But he said he doesn't know if it's going to take care of that because, again, this is very rare. Who knows? He said, it's very strange because, of course, my vocal cords do not have cartilage, but the structures around them are cartilage. So it's like a weird thing. I cannot wait to get off of prednisone and maybe my face will go back to its normal shape. Maybe my neck will go back to its normal shape. I don't look like myself, and I don't like that. I looked the same way for 52 years, and then now suddenly I don't. But, that's kind of where I stand. I go to endocrinology next week. We will, that'll basically be just A1C check, which I anticipate it'll be in the mid sixes, 6.5 or something, because I try not to do so much insulin that I can keep it down where it was before this junk popped up. I try not to just load down with insulin. I don't want to do that either. I'm very careful with everything I eat, but the medication just raises my blood sugar anyway. And then about a week and a half after that, I go back to rheumatology. I'll have lab work done again. So anyway, there you go. That's kind of the update. Have a good day.